Hello, this is Terry Pratt. I'm one of the faculty members for the North American Institute of Manual Therapy, and I want to talk about our Level 1 courses, specifically the C511 Lumbopelvic Spine Course, Level 1. One of the big questions I get asked is, why should I take this course? I already had a scanning examination in physical therapy school. I feel comfortable with it. What will help me be better as a PT by taking this course? So I'm going to answer some of those questions in this little presentation. One of the first answers I would have is integration of the lumbar scanning examination. In the North American Institute, we do have a lumbar scanning examination, and we go through it in detail during this course. So how do we get from the scanning examination to this? Or from the scanning examination to a more efficient gait? So level 1 will be the first step you will take into functional integration. One of the hallmarks of the North American Institute system is clinical reasoning. So during every course, we'll go to great lengths at bringing real live case examples to life with patients that we've seen, or clinical examples of patients we've seen, and try to integrate that with what the medical world shows as far as MRIs, and give you a structure in a way to treat the patient. So we have examples of specific tests that we perform which can correlate to radiographic information. In this case, it's the compression test, which was positive for an end plate fracture in this patient. Efficiency is key in clinical practice nowadays. We're expected to see a wide variety of patients in a shorter period of time and be competent at it. So at the North American Institute, we strive hard to make sure that we can take tests that check functional aspects of movement quickly and apply them to patients' everyday lives efficiently and quickly. So your patients will be satisfied with the treatment that they have, and you'll be satisfied knowing that you did your best for the patient that particular day. In the words of one of my mentors, Earl Pettman, anatomy never lies. So although it seems like physical therapy is moving away from a pathoanatomical diagnosis, I think it's still important to understand where the multifidus is and its functional importance. Supraspinous ligament, what's its function in stability for the lumbar spine? Iliopsoas muscle, how does it coordinate spinal movement? The iliolumbar ligament, when does it get irritated and how do you test it? The long dorsal ligament and sacrotuberous ligaments, what are their functions with the SI joint, and how do we functionally integrate it? So we're going to use different ways to make you familiar with anatomy and functional application of these tests. So it's not just I'm going to do a mobilization and fix the joint, but what is the context of these structures in a functional human being and how do I integrate it? North American Institute offers many options for certification. And if you visit our website, that you'll see that we offer certifications and residency programs, clinical fellowship, and the Doctor of Science through universities that offer this, including Andrews University. And we have different courses that we're offering that will lead you towards your certification. In the North American Institute, we try to be lab-focused and respect your time as a participant to our courses. And we've been working hard to provide online content that you can do in preparation to the course. There might be some videos on pain science and medical screening, and what we try to do is put them in 10-minute blocks or less so that you can review them in the weeks prior to the course. That way, when you get to the course, we can do a lot of hands-on. So do some hands-on training so that you are ready when you go back to the clinic. So you can apply what we've been teaching you immediately in the clinic the next day. Go to NAIOMT.com, where we have links on the courses that we're offering, course schedules, and you can choose by your instructor or by the state that you're in, or you can look for specific course titles. Keep current with us. You can email us, connect with us on Facebook or Twitter, LinkedIn, or go to the NAIOMT blog, and we also have a YouTube page. At the NAIOMT blog, there's always information about current clinical application of the North American Institute material. We know you have choices in the clinical education that you take, and we hope you take NAIOMT for a spin. It should be a lot of fun. So we'll see you at the next course, and have a great day.